Joining us now is Shawn Dew, and Shawn is the supervisor for the Women's Imaging Center with Conway Medical Center. And I've actually been to see Shawn myself. She is a wonderful mammographer. But now that you're over the whole department, much like I asked Fred, how have things changed in your field?
Things have changed dramatically. There's no longer the long delay after we take your pictures, because we can check them in 6 seconds. After we take your thing, we have a 6-second acquisition with the new digital system we have. So we don't leave you alone for 15 minutes to sit there and worry and think about other things, about what we're finding or whatever. If we have to repeat an image, we show you right there, this is why we're going to do this again. And we don't leave the patient alone when we're doing their screening mammography. So that has eliminated some of the anxiety that we used to have a lot of.
Speaking of anxiety, a lot of anxiety recently in the news report when that committee said, maybe women over 50 should have mammograms. We should forget about those women in their 30s and 40s. And I know that made people like you, as well as many cancer patients, furious.
Yeah, the furious isn't putting it in words, because all of the women that we do in their 40s that we've diagnosed breast cancer, their lives are important. And if they didn't have that screening mammogram, they could have been not diagnosed until they were 50, and they could not be alive.
And luckily, the American Cancer Society still supports having women do this.
Every year after age 40, and so does the American College of Radiology. So I think right now women should go to their clinicians and follow the standard of guidelines that are right now. No insurances are changing their coverage, so if there's any question, they can just call their insurance agency and make sure that they're still getting coverage, but I don't believe that they should go there.
Digital mammograms have certainly added, though, to being able to find that cancer fast and find it early and get that woman on the right track.
Oh yeah, we can find things that, we can see the pores of your skin on these digital images, and the radiologists have a wonderful digital workstation where we digitize your prior films. They look at them all on the same media. They can window and level, they can measure, they can magnify, they can do all kinds of manipulation of the images that they could not do before.
Shawn, tell everybody maybe some helpful hints on making sure that they don't miss that annual mammogram. I mean, we should make sure it happens every year, but sometimes that month sneaks up and women just kind of forget.
Conway Medical Center actually has a website, a link that they can actually just put in their date there, and they'll send them an email reminder. They can put it on their calendar and carry it over like birthdays. In the computer age, I'm sure everybody has their little PDA. Yeah.
Now, how about talking about some of the things, how women can better prepare for this. I know that you always remind women they shouldn't wear deodorant when they go in, or perfume, and maybe it's good to tell them why.
The deodorant shows up like an artifact on your film, and the radiologist can assume if it's in your axillary area that it's deodorant, but what if it was a group of cancer cells and we were missing something because you didn't wash it off? So that's why and even if you come with it, we have baby wipes available, and we get them to wipe it off, and we just do just your body. We don't want anything else on it.
Shawn, talk about some of the people that you've seen come in. And of course, we go for this routine mammogram. We really don't expect to find anything. Oh, we've done this 5 or 6 times before. And then you find something. I happen to know that you personally and all the folks over at Conway Medical Center will hold that woman's hand through the process.
Oh, we get it. We've been doing it. Everybody in our department has been doing it for a very long time. We understand the anxiety, we understand the nervousness, and we do our best to try to keep the same technologist through some of the procedures that she's going to have after they do find that diagnosis. And it's not anything that you have to be worried about like you used to. It's not a death sentence anymore.
There are a lot of senior citizens who don't think it's necessary anymore. I think that's a good topic to address.
Your biggest risk of breast cancer is getting older and being a woman, so every single one of us need to have it done.
So let's talk to Shawn about the opportunity that people have who maybe are not wealthy enough to have that insurance that will cover a mammogram. Conway Medical Center has a great unit that goes out to a lot of areas to reach out to women that normally would not have a chance to have a mammogram.
We actually have what they call a mammography foundation grant, and we have money set aside for women that live in Horry County that do have a Social Security number but do not have insurance. And there's information available. If you call the hospital, we can give you that information, but that has to be done by the doctor's office. But we can give them information. We have money set aside for those girls.
And people should never worry about the exposure they're getting from a mammogram.
No, and even with the new digital, the radiation kilovoltage is higher, which is less worrisome than it used to be. So that's even gone out of the picture too.
Any final words, Shawn?
Get your mammogram once a year.
Absolutely. And I love the idea that Conway Medical Center will email you when it's time for you to do it again. So how can we reach you?
347-8135.
Shawn Dew, thank you so much for being with us,
Thank
my
you,
friend.
Diane.
And thank you to Conway Medical Center as well for being a sponsor here on our show.